Hello everyone, and welcome back to MediInsights, your trusted source for in-depth medication reviews and expert advice. Today, we'll delve into Vancomycin Injection, exploring its clinical uses, dosing guidelines, mechanism of action, potential side effects, and essential tips to ensure safe and effective therapy. Stay tuned for clear, concise explanations. Use of Vancomycin Injection. Vancomycin is a glycopeptide antibiotic reserved for serious gram-positive infections, including methicillin-resistant Staphylococcus aureus, Clostridioides difficile colitis, and in patients with penicillin allergy. It is indicated for bacteremia, endocarditis, osteomyelitis, pneumonia, skin and soft tissue infections, and surgical prophylaxis in high-risk settings. Next, dosage of Vancomycin injection. Adult dosing is typically 15 to 20 milligrams per kilogram per dose every 8 to 12 hours, based on actual body weight. For severe infections, dosing may increase to 20 milligrams per kilogram every 8 hours. In pediatric patients, 10 to 15 milligrams per kilogram per dose every 6 hours is common. Renal impairment requires adjustment, so extend dosing intervals or reduce the dose according to creatinine clearance. Routine trough level monitoring is recommended, aiming for 10 to 15 micrograms per milliliter in mild infections and 15 to 20 micrograms per milliliter in complicated or deep-seated infections. Next, mechanism of action of Vancomycin injection. Vancomycin binds firmly to the dealanine terminus of the peptidoglycan precursor in bacterial cell walls. This binding prevents polymerization and cross-linking of peptidoglycan, compromising cell wall integrity and leading to osmotic lysis. Its mechanism makes it bactericidal against susceptible gram-positive organisms. Next, side effects of Vancomycin injection. Infusion-related reactions such as red man syndrome, characterized by flushing, rash, and hypotension, occur when administered too rapidly. Nephrotoxicity risk increases with higher trough levels, concomitant nephrotoxic drugs, or prolonged therapy. Ototoxicity, although rare, may manifest as tinnitus or hearing loss. Other adverse events include phlebitis, neutropenia, thrombocytopenia, and hypersensitivity reactions. Next, important advice for using Vancomycin injection. Always infuse vancomycin over at least 60 minutes and up to 2 hours for doses of 1 gram or more to minimize red man syndrome. Monitor renal function and adjust dosing based on creatinine clearance and serum trough concentrations. Ensure weight-based dosing and avoid concurrent nephrotoxic agents when possible. Educate patients to report tinnitus, dizziness, rash, or changes in urine output promptly. Verify IV line compatibility to prevent precipitation. By the end of this video, you'll have a clear understanding of how to use Vancomycin injection safely and effectively, including key dosing strategies, mechanism insights, side effect management, and expert advice to optimize patient outcomes in clinical practice today.